Welcome to this SaferAfrica e-learning module. My name is Babette de Wilde and I'm working for VIAS Institute in Belgium. I will be your guide through the second session of the post-crash care module. As I said, we're now on the third session of the post-crash care module. As you might know, we've already given you a global vision on post-crash care. Today, we're going to take a closer look at the medical care that is needed when an accident has happened. Help after a crash must be seen as a whole. Help has to be offered from the crash up until the recovery. Today, we are going to discuss this in three parts. We will talk about the different action between the accident and the hospital, pre-hospital care, followed by the medical assistance that occurs in the hospital and the follow-up that every victim should receive. We will start with the pre-hospital care. In this part of the session, we are going to use the term emergency care management. This kind of management consists of a planned and coordinated multidisciplinary process to detect, respond to traffic incidents, and give the victims the necessary care. As post-crash care is one of the 5 pillars of the World Health Organization's action plan, the spectrum of possible actions and interventions in this pillar is very broad and contains a lot of different elements. The World Health Organization provides an overview, as you can see, of the different care aspects for victims and families correlated with the institutions involved and structured around 4 levels of intervention. In this theme, we need to look at the level of injury care. The pre-hospital care coincides with the event at the scene. So as you can see, we're talking about the first response and the importance of efficient and immediate care. For example, we need clarity about accessibility of the emergency services. To do a little warm-up, I'm going to let you guess around. Keeping the previous info in mind, how many people do you think die before they arrive at the hospital? So, if we speak for African countries, the World Health Organization estimates a death rate of about 80% during pre-hospital care. So if we're honest, we have to work on that. To reduce the estimated death rate of 80%, medical care needs to be offered in time, especially when you consider the staggering number of nearly 2 traffic fatalities every minute of the day. To reach this goal, attention must be given to different target groups. A global imperative for the private sector further notes that the lack of medical care and emergency transportation contributes to the high number of deaths and disabilities. Time is an important factor when it comes to an accident. In diverse literature, they use the term golden hour. This to suggest that an injured patient has 60 minutes from time of injury until they receive definitive care. After these 60 minutes, morbidity and mortality increase. Victims should thus receive definitive care within 60 minutes after the crash. The golden hour is similar to the platinum 10 minutes, which place a time constraint on pre-hospital care of seriously injured patients. No patients should have more than 10 minutes of scene time stabilization. In an ideal world, these kinds of actions are carried out by the ambulance staff prior to transport to a trauma center. But as we also know, there are several African conditions in which this is unrealistic. I'll come back to this. This problem makes clear that every citizen must know how to respond. A good idea would be to give every citizen a basic training in first aid in the event of accidents. In this way, the necessary care can be started within the golden hour and the platinum 10 minutes. There are different countries that already have their own training system for people who are often confronted with car accidents. For example, Kenya. Kenya has a road safety advocacy group which equips drivers with a public minibus and traffic police with knowledge and skills to attend to road crash survivors until professional medical personnel arrive on the scene. A second example is South African system. It's the EFAR training system that is developed in a South African township. It's a training for community members to learn them life-saving first aid skills that they might require to care for the injured until professional assistance is available. All the aspects we have seen before are important in this situation. We see a picture of a hectic accident. Now it's important to react appropriately. There are a lot of people involved in the situation, and they are all in a way responsible for the pre-hospital care. The World Health Organization provides a traffic crash response system, which gives an overview of the different stages that can provide effective and efficient assistance. This overview confirms the multitude of people involved. We will subsequently discuss the various actors one by one. These are the different target groups, the different actors involved in the stages after an accident. The group of bystanders includes eyewitnesses and others in the vicinity of the accident. The dispatchers are the people who communicate, organize, coordinate, monitor, and supervise an environment. Medical services refer to the facility-based emergency care. We're talking about a well-equipped hospital as well as a well-equipped first aid unit. There's not only a need for well-equipped staff, also the mode of transportation is very important. So first things first, the bystanders. As we all know, the first people on the scene are the bystanders, making them very important. In a lot of African cities, the emergency services are not reachable that fast, nor are they close by. So as mentioned before, when talking about the golden hour, it would be good that every citizen receives basic knowledge about first aid. The bystanders are especially expected to activate the traffic crash response system and chain of assistance in the following teams. It's important for bystanders to guard the place of the accident, to wear reflective clothing, to not stand in the road, and to try to warn other persons that there is an accident. Second, to alert emergency services. Call the emergency number and inform them of what has happened with the precise location and details about the crash. It depends on the situation to know what to do or who to call, but most of the citizens have a smartphone which they can use to search the required number. Help victims. Make it clear to people that people in need always have priority over their daily tasks. You can teach this attitude in a first aid course. For the bystanders, some things are obvious, but others depending on their knowledge and ability. For example, it is possible to not move people who are injured nor remove helmets from motorcyclists. Calm those who are injured. Offer first aid if qualified. Even the most sophisticated emergency care system is ineffective if bystanders fail to recognize a serious injury or do not know how to call for help. As we saw, one of the important things is to inform the emergency services. But do you know which number you dial in case of an emergency? In the best case, this is a dispatcher, who can rapidly dispatch the right service. The necessary emergency service depends on the type of the emergency. A dispatcher coordinates all of this to ensure timely and efficient assistance. In this job, it's advisable to recruit retired professional drivers, such as cab drivers, who already know the layout of the city very well. The most efficient way to introduce this responsive system is a single general access number that is valid, countrywide and linked to a centralized service. Also, the number needs to be available as a free call from every telephone and easy to remember or dial. Needs to be linked to a dispatch center that can rapidly send an equipped ambulance with trained personnel. When this kind of initiatives is not possible, we can opt for simple systems that only require mobile numbers for each kind of accident. For example, one number for the emergency care, one number for the fire department, and another for the police. And what do you think? How many countries have a national emergency number? As of 2016, only 50 to 60% of countries have a national emergency telephone number. In the south of Africa, none of the countries have an emergency number. The third step of the process of pre-hospital care is the intervention of medical services. Emergency care for injury is at the core of post-crash response. Effective care of the injured requires a series of time-sensitive actions, beginning with the activation of the emergency care system and continuing with care at the scene, with transport and facility-based emergency care. In addition to the quality of assistance, as many people as possible must be helped by offering efficient care. For this, the World Health Organization has made a kind of guideline to work in an efficient way. This guideline consists of the following 6 phases. First of all, we have triage. It's sorting and treating patients according to priority. Identify and treat patients with life-threatening conditions first. The second phase is the primary survey, and this is to examine, diagnose, treat life-threatening injuries as soon as they are diagnosed. Use simplest treatment possible to stabilize patients' conditions. Life-threatening injuries are airway obstructions, breathing difficulties, severe external or internal hemorrhage. So, the third phase and the fourth are the secondary survey. They perform a complete, thorough patient examination to ensure no other injuries are missed. Then next we have the stabilization. Make the victim ready for transport to the hospital. The other 2 phases will be talked through in the other session. When pre-hospital care is completed, it must be followed up as soon as possible by further hospitalization. In order to keep the condition of the victim as stable as possible, transport must be done rapidly and safely. As you can see, you have diverse means of transportation. Transfer of the injured, either from the scene of an injury to a facility or between facility, has two distinct components. The means of transport is very important. Well-equipped ambulances are a minimum requirement to ensure a qualitative assistance for the victim. Care during the transport. Trained staff are ideal for this. They best allow the delivery of uninterrupted life-saving care before reaching the hospital. We are aware that many African countries and cities are very rural, but as you can see on the pictures, some of the countries already have a solution, namely a motorcycle that can run on the rural roads. When ambulance transport is not available, can the police do something, or do we have to get back to the bystanders? For example, as we said before, the basic training. As we can transfer the victim safely to the hospital, we can start a follow-up of the victim, including an intensive treatment of the wounds. We speak about effective medical care within this team. Effective emergency care requires dedicated emergency area. An emergency department is a medical treatment facility specializing in emergency medicine. The accurate care of patients who present without prior appointment, either by their own means or by that of an ambulance. Trained providers, non-rotating. People who are specialized in specific medical domain such as surgical or medical technology or phlebotomy. It is important that there is an on-site expert at all times who can take care of the emergency cases. Also, it is recommended that the number of experts is in proportion to the average number of injured. Then protocols and checklists for a systematic approach. When several people work in the same setting, it's important that agreements are made. Everyone should receive the same assistance, and to ensure this, a protocol is the most steadfast. Last, the essential equipment for diagnosis and treatment. In the line of trained providers, it is important that they also have the right equipment to do their job and make the right conclusions. Children are in need of special care on different levels. On the medical level, it's important to educate pre-hospital and facility-based providers about the distinct treatment needs of children. On the psychological level, children understand less and experience the unknown as a threat. It's important to calm down the child and win their trust. On the legal level, it's important to know who you should be notified. Who's responsible for the child, and can we reach him or her? Because children are in need of special care, the hospitals have to provide specific staff as well. Specific staff as well as specific equipment, like a pediatric transportation system. Just like making the healthcare facilities as child-friendly as possible to minimize additional trauma for the injured children. When the wounds are treated and the victim is stable, one starts with rehabilitation. This can be at home with assistance, at the hospital, or at a specialized rehabilitation center. We are going to explain the different types of rehabilitation in the next session. We have reached the end of this session. Now it's important for you to think about a few keywords that have been given a meaning through this session. Reflect for yourself how these concepts come into play on the road according to you and which words are missing. The golden hour is to indicate the importance of time efficiency. Because we work with vulnerable people, the timing is of great importance in the various phases of assistance. Know-how is an important concept for the expertise. It is important to have a medical expert as well as the residents of knowledge about first aids. Learn people how to intervene. This refers to the training for the residents. When everyone is well informed about what to do in an emergency situation, work can be done in a golden hour. Then resources, the ambulances, the educated staff and the medical equipment. The world is an innovative and evolving whole, and that has to be used. The innovative issues that exist today can have a major impact on the fight against road deaths. Thank you all for your attention. You can download a PDF of this presentation from the website. You can also download a PDF with references and further readings on the subject. The next session on post-crash care is mental health care.